Okay, good morning. My name is Alana Deaning, and I'm here in support of children with diabetes across the province in Ontario schools, as well as their parent advocates. Firstly, I want to thank MPP France Galinas for sponsoring our presentation today, introducing us in the gallery, as well as presenting our petition. Here with me are T1D parent advocates, Emily Dermay, Jamie, and Neil Ills. We also have their daughter, Ellie, who represents what this is all about, our kids living with type 1 diabetes every day. We are so very grateful to have Olympic athlete, founder of not-for-profit I Challenge Diabetes, Chris Jarvis, here supporting us as well. Chris lives with type 1 diabetes himself and has been actively supporting kids in schools for over 15 years. Joining us by phone will be McMaster University-based pediatric endocrinologist and T1D Policy in Ontario Schools researcher, Dr. Hannah Getty. Her research has been foundational to help us as parents know we're not alone. I also want to thank Tina Yazdani and Allison Jones for helping to give our parents a voice. Current status is that we do not have a mandatory standard of care to guide all school boards for type 1 diabetes. This leads to a patchwork that can vary from school to school, principal to principal, or teacher to teacher. I've been relentlessly dedicated to supporting the Ministry of Education to create a mandatory standard of care since December 2024. It's been a long and winding path, with highs such as receiving a callback from Premier Doug Ford that led to conversations with Minister of Health Sylvia Jones and Minister of Education Paul Calandra. It has also included lows as we continue to witness small children being harmed by this lack of policy protection as the ministry continues to consider its next steps. Traditionally prevalent medical conditions in our province do not receive a condition-specific policy until the worst happens, such as with Sabrina's Law, Ryan's Law, and Rowan's Law. My fellow parents and I will continue to do everything in our power to stop this from happening for type 1 diabetes. We want Ontario to join BC, Nova Scotia, PEI, and soon to be Saskatchewan, who have mandated standards of care aligned with Diabetes Canada's guidelines for the care of students living with diabetes at school. Now I'm going to welcome Emily Dermay to come share her voice as a type 1 diabetes parent advocate.
Thank you. Good morning, and thank you for letting me have the opportunity to speak here today. My name is Emily, and I'm here as a mother advocating not only for my son Levon, but for every child in Ontario living with type 1 diabetes. My son was diagnosed in January 2024 when he was 2 years old. Every parent of a child with type 1 diabetes knows diagnosis changes your entire life overnight. Suddenly, your child's survival depends on constant monitoring, insulin calculations, emergency planning, and immediate responses to dangerous blood sugar, both lows and highs. But what shocked us the most was not the diagnosis itself. It was discovering how unprepared our school system was to safely support him. Before Levon started school this past September, we did everything we were supposed to do. We notified the school board early. We provided a detailed draft plan of care. We supplied emergency kits, fast-acting glucose, training materials, instructions for his continuous glucose monitoring, and information for recognizing hypoglycemia. We walked in believing that if we partnered with the school, our son would be safe. Instead, within days, we found ourselves in a completely unacceptable situation, one where our son's human rights were being violated. Staff responsible for caring for our son refused to provide fast-acting carbohydrates during lows because they believed juice and glucose tablets were medicine. Teachers stated they were not comfortable responding to his diabetic needs. There was confusion about responsibility, confusion about training, and no standardized process that protected our child. Imagine being told that the treatment your child needs to prevent a medical emergency might not be given because the adults are afraid of policy interpretation. Imagine sending your 3-year-old to school wondering whether someone would respond to his blood sugar if his blood sugar dropped dangerously low. Imagine realizing your child does not have safe, equal access to education because of a disability. This is what happened to our family. We ultimately removed Levon from school because he was no longer safe. No parent should ever have to make that decision in Ontario. And the hardest part is knowing that this is not an isolated incident. Families across the province are facing inconsistent policies, inconsistent training, and inconsistent support, depending on which school board they're in or even which school their child attends. Children with type 1 diabetes deserve more than luck. They deserve standardized provincial protections. We need mandatory training for all relevant staff. We need clear provincial standards for diabetes in school. We need accountability when plans are not implemented. And we need schools to understand that supporting children with disabilities is not optional. It is a human right. Levon deserves safe access to education. Every child in Ontario does. Thank you.
Thank you, Emily. Now I want to welcome Jamie to share her voice as a type 1 diabetes parent advocate.
Good morning. I just wanted to say thank you for taking the time to hear us today. As parents, we always want what's best for our children. But in our case, we're pleading for a standard of care to keep our kids safe while they're in school. Someone to hear us and meet us even a quarter of the way with our kids and their special needs while they try to live as normal life as they can before they take on the full burden of managing their disease. Ellie was diagnosed with diabetes shortly before her second birthday. She's about to finish grade 1. Currently, because of policies and regulations, no one at Ellie's school is allowed to or trained to administer insulin, despite it being necessary for her body to function properly. We have no direct line of communication between ourselves and someone at the school in the case of an emergency, aside from the general phone number that they give every parent. Depending on what's going on there, they may not answer. We have a nurse from an outside agency who attends only at mealtimes to administer insulin. However, this is often done either while she's eating or after, resulting in the insulin being late to take effect, leading to high blood sugar. Insulin is a life support to a diabetic. An insufficient amount can cause her to feel off, in a brain fog, and not able to focus on her schoolwork. Having high blood sugar for too long can also cause serious long-term effects to diabetes, such as issues with her heart, kidneys, eyes, and blood circulation to her limbs. Unfortunately, Ellie's had a handful of substitute teachers this year, making it even more of a struggle to communicate and maintain a standard of care. At 5 years old, Ellie was teaching her principal how to do a finger poke to check her blood sugar levels when her continuous glucose monitor was having issues. We've experienced lows resulting in unconsciousness in the middle of class. Ellie's primary issue is she tends to run too high at school for the reasons I mentioned earlier. Having someone at the school trained and able to give corrections throughout the day will absolutely resolve this issue and will allow her to not only focus better at school, but will also keep her more healthy overall. We've also experienced instances of miscommunication at our care instructions. In one incident, a person confused a carb count amount with a unit amount on Ellie's pump, resulting in a dangerous amount of insulin being delivered. These situations make it difficult to focus on our jobs when we're constantly monitoring her levels. I work in a hospital. I'm constantly checking my phone and Ellie's readings. I'm texting with the nurse, providing insulin doses as Ellie's eating. My husband's a police officer. He's on several serious calls for service while Ellie is experiencing an issue. He's had to go to her school while on duty, and I've had to leave the hospital to change her continuous glucose monitor or infusion sets. We've had to stagger our schedules so we can be available as often as possible to deal with these issues, but that's simply not enough. I've been placed in our attendance management program at work several times because I've had to either call in or leave early to attend to Ellie's needs. We need a safety net, a person in the school who can administer insulin properly and who can otherwise manage our children's diabetes so they can be at their best while in school. We're asking for help for a standard of care in our schools across Ontario before I'm back here fighting for a law in Ellie's name. Thank you.
Thank you, Jamie. And now we have one of our fearless leaders, Chris Jarvis, to share from his decades of experience.
Thank you. And thank you to these parents who are sharing their stories now. My story started over 30 years ago. I was diagnosed 31 years ago with type 1 diabetes, but not before my little sister, who was diagnosed at 4 years old. And knowing what that experience was like as a family, not sure what was happening to my little sister, and not even sure how to help. This was a traumatic experience for us. and my family didn't know how to train my older sister and myself how to support my little sis, let alone the school system. And that's why when I grew up with type 1 diabetes, I remember the experiences that I had in school, sometimes listening to the general rules that all students are taught, not to eat in class, and feeling that low blood sugar symptom, and wanting to wait until the clock struck so that I could go to recess and eat my snack. Those kinds of systematic things that are in place are not adjusted for someone with type 1 diabetes right now until there's a rule here in Ontario. So going beyond that, I was able to be supported by some wonderful teachers throughout our school system. And those teachers helped to build me up so that I could continue on not only in school to become a chemical engineer, but also to row for Team Canada and compete at the Olympics in Athens and winning a gold medal in Rio de Janeiro in Greece. But with that, I felt like I needed to do more for this community. So many wonderful people that are speaking out here today, as well as over time. So I've started an organization which goes into schools and helps teach what those teachers can do, what those students can do for their students so they're aware. And I've done this in over 300 schools myself, as well as other team members from our organization at iChallenge Diabetes. And what I find is that in other provinces, there is this standard. And there's an understanding when I go into the school and I see the same instances over and over. Whereas here in Ontario, it's different from one school to another. Some administrations, when I go in, they don't even know who has diabetes within their school. These are some scary realities. And the ability for a parent to advocate is not the only component, but that is a component that reminds me of my family and our shock that we were in. We wouldn't have been able to be that advocate to lay out a 10-point plan. Some parents are able to do that, but when they meet a teacher, as was mentioned, who's not willing to do it, who looks at their ability to work around this because there's no structure in place, it's just a scary situation. And seeing these wonderful kids, we need to come together because that is their right. And if we provide the structure from Diabetes Canada guidelines across Ontario, this is a way to keep our students safe, to give them the chance to learn just like every student should. Thank you.
Thank you. Thank you, Chris. So in Hannah Getty's research on Ontario type 1 diabetes policy, it clarified that 37% of caregivers stopped work related to diabetes care at school. If we look at the newly released proposed changes to PPM 161, we note some positive steps forward. There is a mention that plans of care must include things like field trips, school buses, overnight excursion, board-sponsored sporting events, and board-operated before and after school programs. These could be incredible improvements. It mentions standardized training for school boards that would establish province-wide minimum levels of knowledge. This too could be incredible. It mentions that the ministry providing standardized condition-specific plan of care templates that require a healthcare professional's information and signature. This step could decrease the chance that educators are being asked to have a healthcare provider level of knowledge about what is mandatory to keep a child safe. But I have concerns about access and healthcare provider capacity. These all have the potential to be incredible steps forward. Unfortunately, the individuals that will find out how effective these changes are will be our children, sometimes as young as 3 years old, while already dealing with a difficult condition. I have concerns that remain, including the updates using words like the ministry encourages the identification of a staff person to support the daily and routine management. This wording is simply not going to be enough. Would you encourage a school to keep kids safe at the swimming pool, or would you require it? There's no condition-specific guidance mentioned, like nasal spray glucagon, insulin administration, or CGM monitoring, and it will be very important to determine what is in the standard annual education and condition-specific care of plan templates. Okay. So I want to extend a warm welcome to Dr. Hannah Getty to share from her wealth of knowledge.
Hi, good morning. Thank you so much for having me today. As mentioned, my name is Dr. Hannah Getty. I'm a pediatric endocrinologist and working in Ontario with a fairly large population of patients who have type 1 diabetes. And I'm here today, very grateful to be here to offer a clinician's perspective on what I feel is an incredibly important issue. As we probably already talked about today, type 1 diabetes is a chronic illness increasing in frequency among children in Canada. As families who live with type 1 know, but many other people do not, diabetes is a very treatable condition. We know very well what to do to manage it, but it is a relentless one. Diabetes is at its core, it's a disease of abnormal blood sugar. And keeping a child with diabetes safe and healthy requires constant monitoring of blood sugar and management when the blood sugar becomes too high or too low. That monitoring is constant. There's no vacations. It impacts every single night, every single day at school, and impacts the family 24/7. Like many endocrinologists that I work with, I'm passionate about this issue because of my patients. In our clinics, we hear very different accounts of how our patients are managed at school and how things are going. And when things don't go well, we really see the consequences. We see very poor blood sugar control, lots of challenges in diabetes management, complications related to diabetes, poor school engagement, and certainly extreme pressure that is placed on working parents. There have been very important developments in the care of children with type 1 in school. We now have access to continuous glucose monitors. We have access to insulin pumps, which are revolutionizing the management of this condition. And since 2018, we do have Policy Program Memorandum 161, which is a really important step forward and will continue to play a crucial role with the changes being proposed. But despite this, we continue to see our patients and our children with type 1 diabetes who are struggling at school. And one very important reason for that is that policy is being implemented differently in different schools and different school environments. It isn't specific enough. Responsibility is not assigned, or it's not clear, or sometimes assigned to people who aren't able to carry out that responsibility, such as parents who are working full-time and unable to be present with their with their child throughout the school day. There is a lack of accountability in terms of schools following that policy appropriately. Diabetes does not require nurses or doctors to manage it when children are at home or at school, but we do need educated and caring adults who are able and willing to support a child with diabetes when they're in the classroom. And when we don't have this, then any policy or any care plan, no matter how excellent it has been, it will fall apart. And that leads to very young children being told to inject themselves with insulin or be sent home. It can lead to parents being required to quit their jobs to attend to their child at school. Even parents being told that their child is unable to attend school in defiance of their human rights. So we are here today to advocate for mandatory standards of care across the province that align with Diabetes Canada guidelines. It is absolutely essential that school personnel, and that means teachers and EAs and others, are properly educated and supported when they have a child with type 1 diabetes in their classroom. We must be able to assign responsibility and have school personnel participate in blood sugar monitoring and management according to that child's care plan. There must be a caring and educated adult who is with them who can identify when that blood sugar is too high or too low and that child is in danger, and can determine what to do to keep them safe according to the care plan that's been set up by the family, their healthcare providers, and the school. Overall, we need to improve aspects of our policy in order to make this very clear and then make sure that there is appropriate accountability. We should improve access to diabetes-related technology, and in particular, earlier access to pump technology, which right now is only accessible a year after diagnosis. And finally, as stated, policies should not exist only on paper. There must be accountability for schools and school boards to ensure that these standards are met, because no child's safety and future health should depend on what school they go to. Those are my comments for today, and thank you so much for having me again to speak.
Thank you, Hannah. So we are asking the provincial government to let approximately 3,000 of us parents go back to work. Please help us prevent situations from occurring like what we saw in the Kingston WIG with 5-year-old Eloise being asked by her school to dose her own, potentially lethal, insulin. Help us prevent parents from being forced to use NPH insulin or having to ask a slightly older sibling to inject their very young sibling twice a day for the entire school year. Or from families moving from another province only to be rocked by their new reality here. Please help us prevent the tossing out of 97% of cases at the Human Rights Tribunal, or schools refusing to look at a child's blood sugar numbers that are so easily accessible on their ADP program covered Dexcom app to ensure their basic safety before things like recess, gym, and bus. Help us prevent students from being asked to walk alone to the office when they're having a low, where they could go unconscious in a hallway and no one will know where they are. Help us prevent school staff from being stretched so thin that they can't properly care for our kids, or the neglect of special considerations for children with type 1 diabetes and another condition like autism or ADHD. Or forgetting to include type 1 diabetes training for things like lockdowns or when there's a revolving door of supply teachers. Thank you to the Ministry of Education staff for continuing to push this work forward. Any Ontario parents looking for more support, you have Chris's Diabetes School Visiting Program, and you can find me in our SOS T1D Parent Advocate Group. We're here to support you. You're not alone. The Ontario Regulatory Registry needs as much feedback as possible. The PPM 161 update is posted. This is a once-in-a-decade opportunity, so make sure you take the time to provide your feedback on what you want to see. Thank you to Diabetes Canada for providing clear guidelines regarding a mandatory standard of care, so the Ministry of Education is receiving clear, consistent guidance regarding what is needed. Thank you.